If you're over 50, your sleep isn't just about rest, it's about survival. What feels like a harmless bedtime routine could be quietly damaging your heart, your brain, or even cutting years off your life. You've worked hard for your peace. Don't let poor sleep habits steal it away. Many seniors overlook the warning signs until it's too late. But tonight, you have a chance to change that. Let's talk about 7 dangerous sleep habits that might seem small, but they could be fatal. And if you fix them now, you just might give yourself the gift of a longer, healthier life. If this message speaks to you or someone you love, take a moment to subscribe. We share real, caring advice to help you stay strong, sharp, and safe after 50. Like this video to spread the word, and comment below if any of these habits sound familiar. We're in this together. Number 1. Falling asleep with the TV on may seem like a harmless habit, but for adults over 50, it can quietly disrupt sleep health in ways that are far more serious than most people realize. The glow from a television screen emits blue light, which interferes with the brain's natural production of melatonin, the hormone responsible for regulating sleep. When melatonin levels drop, the body struggles to maintain its internal clock, also known as the circadian rhythm. This rhythm helps signal when it's time to sleep and when it's time to wake. Disrupting it doesn't just make falling asleep harder, it also affects the overall quality and depth of rest, which becomes more critical with age. Some doctors warn that consistent exposure to artificial light at night can lead to shallow, fragmented sleep, meaning the body never fully enters the deep, restorative stages it needs. As people age, the body's ability to reach those deeper sleep cycles naturally declines. Introducing extra light into the room only worsens this. When the TV is left on, the eyes and brain remain partially engaged, even during sleep. The flickering light, sudden volume changes, and even the changing colors stimulate brain activity, when the mind should be winding down. Over time, this can contribute to chronic sleep debt, a condition that reduces alertness, slows reaction time, and increases the risk of falls and injury. There is also growing concern among sleep researchers about the long-term neurological effects of poor sleep in older adults. In several studies, including those published by sleep research institutions, disrupted sleep has been linked to cognitive decline. This includes problems with memory, attention span, and mental clarity. When a senior experiences night after night of reduced sleep quality because of background noise and artificial light, the brain doesn't get the chance to reset and repair. Some neurologists have connected this ongoing sleep disturbance to increased risk of developing dementia-related conditions, such as Alzheimer's disease. Beyond the brain, poor sleep caused by falling asleep with the TV on can affect cardiovascular health as well. According to the American Heart Association, irregular or insufficient sleep can increase blood pressure, elevate inflammation in the body, and impair the functioning of blood vessels. These issues are especially dangerous for seniors who may already be managing chronic conditions like hypertension or heart disease. What might start as a preference for background noise or comfort can, over time, become a serious contributor to cardiac problems. In addition, there are subtle psychological effects. Some sleep specialists point out that falling asleep with the TV on creates a passive bedtime routine. Instead of gently easing into rest, the brain remains distracted by external stimulation. This can lead to an over-reliance on background noise to fall asleep, making it harder to sleep in silence or unfamiliar environments. For seniors who may already struggle with sleep due to changes in hormones, aches, or stress, this reliance can further complicate their ability to rest naturally. There are also safety concerns. A loud or sudden sound from a program could cause abrupt waking, confusion, or even disorientation in the middle of the night. In homes where someone may get up in a rush to turn off the TV or investigate a sound, this could result in falls or injuries. an especially serious issue for those with limited mobility or balance problems. Health experts generally recommend keeping the sleeping environment dark, quiet and free from screen time at least 30 minutes before bed. If noise is comforting, many suggest using low-volume white noise machines or calming music without visual stimulation. That way, the auditory environment can remain soothing without interfering with melatonin production or engaging the brain unnecessarily, while watching TV before bed is a common routine. Allowing it to stay on throughout the night puts sleep quality and overall health at risk. For seniors, making the small change to turn off the television before sleep could mean fewer restless nights, better memory, more energy during the day, and even a lower risk of chronic disease. When it comes to protecting long-term health, especially after 50, how and where we sleep matters, and sometimes that starts with something as simple as a quiet, dark room. Number 2, relying on sleeping pills. Nightly, relying on sleeping pills every night may seem like an easy solution to restless nights, but for seniors, this habit can quietly cause far more harm than good. Many medications used as sleep aids, especially those classified as sedative hypnotics or benzodiazepines, work by slowing down brain activity. While they may help someone fall asleep faster in the short term, repeated use over time can have serious side effects that grow more dangerous with age. For adults over 50, the body's metabolism slows down, meaning these medications stay active longer. This lingering effect increases the risk of next-day drowsiness, impaired coordination, and cognitive fog. Some doctors warn that prolonged use of sleeping pills in older adults is strongly linked to balance problems and a higher risk of falls. Falls remain one of the leading causes of injury and death in people over 65, and medications that affect the central nervous system can make it harder to stay steady on your feet, especially at night or early in the morning. Getting up to use the bathroom or walking to the kitchen while under the lingering influence of a sedative can easily result in a misstep, a hip fracture, or a dangerous head injury. These risks aren't just theoretical, they've been confirmed in multiple long-term studies focused on senior safety. Beyond physical risk, memory and mental clarity are also affected. Regular use of sleeping pills has been associated with confusion, forgetfulness, and difficulty concentrating. These cognitive symptoms can mimic early signs of dementia and often create distress for both the individual and their loved ones. Research published in medical journals has shown that long-term use of certain sedatives may even accelerate cognitive decline. This is especially concerning because many people begin using sleep aids to manage age-related sleep changes without realizing the trade-offs they're making in brain health. Sleep medications can also interfere with the brain's natural ability to regulate sleep cycles. Instead of helping the body achieve the deep restorative stages of sleep, they may produce a lighter, more artificial version of rest. Over time, this can lead to dependence, not just physically, but psychologically. Some people begin to feel anxious about the idea of falling asleep without a pill, believing they can't rest on their own. This cycle of reliance can become deeply ingrained, and it can make the process of improving sleep habits naturally much harder later on. Another concern is the interaction between sleep aids and other medications. Many seniors already take prescriptions for blood pressure, heart conditions, diabetes, or arthritis. Adding a sedative to the mix increases the chance of negative interactions. Some medications, when combined with sleep aids, can amplify sedation, cause dizziness, or depress breathing. This is especially risky for individuals with conditions like sleep apnea or chronic respiratory issues, where breathing may already be shallow or disrupted at night. Doctors and sleep specialists often encourage patients to explore safer, long-term strategies before turning to nightly medication. While occasional use of sleep aids may be acceptable for short periods, such as during a temporary crisis or after surgery, daily use should always be approached with caution. Even over-the-counter options, like antihistamines marketed as sleep aids, are not without side effects. These drugs can cause dry mouth, urinary retention, and grogginess that lingers well into the next day. For seniors, that grogginess isn't just inconvenient, it can be dangerous. Many medical guidelines now recommend that older adults avoid using sedative hypnotics altogether unless absolutely necessary. The American Geriatric Society includes these medications on their list of potentially inappropriate drugs for seniors. Their advice is clear. While sleep is important, the risks of relying on pills to get it outweigh the benefits. For those already taking these medications regularly, it's important to consult with a healthcare provider about safe ways to taper off. Stopping suddenly can cause withdrawal symptoms, including rebound insomnia or increased anxiety. What often begins as a quick fix for sleep trouble can slowly develop into a health issue on its own. Seniors are encouraged to look closely at how often they're reaching for a pill to fall asleep and to consider whether that habit is truly helping or quietly hurting. In the long run, protecting brain function, balance, and overall well-being is worth finding a healthier, safer path to rest. Number 3. Skipping daylight exposure. Skipping daylight exposure disrupts one of the most essential regulators of sleep and mood, the body's internal clock, also known as the circadian rhythm. This internal system relies heavily on natural light cues to stay aligned with the day-night cycle. When older adults spend most of their time indoors, especially in the morning hours, the body loses its natural signals to stay awake during the day and wind down at night. Without this rhythm, the quality and timing of sleep can begin to break down. For many seniors, this leads to trouble falling asleep, waking up too early, or experiencing fragmented, shallow rest. Natural sunlight in the early part of the day helps reset the circadian clock every morning. Light exposure, particularly within the first 1 to 2 hours after waking, signals the brain to stop melatonin production, the hormone that helps induce sleep, and begin producing cortisol, the hormone that keeps you alert and focused. Missing this daily reset confuses the brain's timing system, making it harder to feel sleepy when nighttime arrives. The result is often delayed sleep onset, increased nighttime wakefulness, and poor sleep efficiency, all of which are common issues reported by older adults. This lack of light exposure doesn't just interfere with sleep. It also has a measurable impact on mood and mental health. Some studies have found a strong link between limited daylight and higher rates of depression in older adults. This is partly due to how light influences neurotransmitters like serotonin, which plays a role in mood regulation. Seniors who remain in dim indoor lighting for most of the day may not produce enough serotonin, leading to feelings of fatigue, sadness, and lack of motivation. Over time, this can contribute to more serious mood disorders, including seasonal affective disorder, SAD, and major depression. There's also concern about the connection between reduced sunlight exposure and cognitive decline. Research has suggested that seniors who don't get enough natural light may face a higher risk of developing dementia-related conditions. Inadequate light exposure has been linked to disrupted sleep cycles, decreased physical activity, and social isolation, all factors that contribute to cognitive deterioration. When the body's rhythm is out of sync, the brain can suffer, especially over time. Doctors often encourage seniors to spend at least 30 minutes outside each morning, even if it's just sitting near a window that lets in full daylight. Getting outside in the morning, even on cloudy days, can help reinforce the brain's natural timing and support better sleep at night. Light therapy boxes are sometimes recommended in cases where natural sunlight isn't available, such as during winter months or for those with limited mobility. These devices mimic the brightness of daylight and can help reset the circadian rhythm when used regularly in the morning. Consistent daylight exposure is a simple but powerful way to protect sleep, mood, and cognitive health. For older adults, making a habit of stepping outside each morning can be one of the most effective and natural tools for better sleep and emotional well-being. Number 4. Drinking alcohol. Before bed, drinking alcohol before bed may seem like a harmless way to relax, but for adults over 50, this habit can quietly interfere with the body's natural sleep cycles in ways that have long-term consequences. Alcohol acts as a sedative at first, making it feel easier to fall asleep. However, as the body begins to process it during the night, alcohol disrupts the deeper stages of rest, particularly REM sleep. REM sleep is vital for memory consolidation, emotional balance, and immune function. When this stage is repeatedly interrupted, the brain and body don't get the full restorative benefits of a proper night's sleep. Many sleep experts have found that alcohol leads to more frequent awakenings in the second half of the night. While someone may fall asleep quickly after drinking, they are more likely to wake up in the early morning hours, feeling restless or unable to return to sleep. This sleep fragmentation is especially harmful for older adults who already tend to experience lighter sleep due to changes in sleep architecture that come naturally with age. Adding alcohol to the mix compounds the problem, making restful nights even harder to come by. There is also the issue of sleep quality, not just quantity. Studies show that alcohol reduces overall sleep efficiency. It causes the body to spend more time in lighter, less restorative stages of sleep and reduces the amount of time spent in REM sleep. For seniors, this is particularly concerning because REM sleep plays a key role in maintaining brain health. During REM, the brain processes emotions, stores memories, and supports cognitive functioning. When REM is regularly shortened or disrupted, it may contribute to memory problems, mood instability, and even a faster rate of cognitive decline. In addition to disrupting sleep cycles, alcohol can also increase the need to urinate during the night. This happens because alcohol is a diuretic, which means it encourages the body to lose fluid. For seniors who already deal with age-related bladder issues or prostate problems, alcohol before bed can lead to more frequent trips to the bathroom, increasing the risk of falls and sleep disturbances. This constant waking puts additional stress on the body and makes it harder to enter deep, healing sleep stages. Some doctors also caution that alcohol use before bed can aggravate conditions like sleep apnea, a disorder that is more common in older adults. Alcohol relaxes the muscles of the throat, increasing the chances of airway obstruction. This leads to loud snoring, gasping, and temporary pauses in breathing during sleep, none of which allow the body to rest properly. Untreated sleep apnea is linked to high blood pressure, heart disease, and stroke, all of which pose increased risks with age. Relying on alcohol as a nightly sleep aid often turns into a cycle that gets worse over time. As sleep quality decreases, some people drink more to compensate, which only deepens the problem. Health experts widely agree that while occasional alcohol use may not cause lasting harm, making it a regular part of a bedtime routine can erode sleep health and overall well-being. For seniors especially, choosing other calming routines, like light reading, stretching, or herbal teas, can help signal the body that it's time to rest, without the side effects that come with alcohol. Protecting sleep means protecting the brain, the body, and the ability to enjoy each day with energy and clarity. Number 5. Sleeping too long or oversleeping regularly. Sleeping too long on a regular basis may seem like a luxury, but for older adults Consistently sleeping more than 9 hours per night can actually be a sign that something more serious is going on inside the body. While sleep is essential for restoring energy and maintaining health, oversleeping has been linked in numerous studies to higher risks of heart problems, poor circulation, and even early stages of neurodegenerative conditions. It's not just about how long a person stays in bed. It's about why the body might be demanding that extra time. One concern with regular oversleeping is its connection to heart health. Researchers have found that adults who sleep more than 9 hours per night have a higher likelihood of developing cardiovascular disease, including issues like high blood pressure, stroke, and irregular heartbeat. In many cases, excessive sleep can be a response to undiagnosed low oxygen levels during the night, which often occur in conditions such as sleep apnea or chronic respiratory problems. When the brain and heart aren't getting enough oxygen, the body tries to compensate by demanding more rest. However, that extra sleep doesn't always improve health. It may instead mask underlying problems that need medical attention. Another reason oversleeping should raise concern is its association with reduced brain function. Studies have observed that people who consistently sleep too long tend to score lower on memory and thinking tests. This may be due to a combination of disrupted sleep architecture, less physical activity during the day, and slower metabolism. For seniors, whose brain function may already be affected by natural aging, oversleeping can signal the early development of conditions like mild cognitive impairment or dementia. While poor sleep can worsen memory and focus, too much sleep may also indicate that the brain is struggling in ways that require further evaluation. Oversleeping can also lead to physical issues such as stiffness, back pain, and reduced mobility. When a person spends long periods in bed, it can limit circulation and muscle activity, increasing the risk of muscle weakness or joint discomfort. Seniors who are less mobile to begin with may find that extended sleep makes it harder to stay active, which can affect balance, flexibility, and even independence over time. This reduced mobility also contributes to lower energy levels and a greater sense of fatigue during the day, which ironically may lead to even more sleep. Medical experts encourage seniors to monitor their sleep patterns closely. While some variation is normal, a sudden or ongoing need for excessive sleep should not be ignored. In many cases, it's not just the symptom, but the underlying cause that needs attention. Conditions like depression, hypothyroidism, or certain vitamin deficiencies can also lead to oversleeping and should be evaluated by a healthcare provider. The goal is not to reduce rest, but to ensure that sleep is high in quality, not just quantity. In older adults, sleeping too much on a regular basis may feel like the body is simply tired, but it's often a quiet warning that something more serious may be going on. A healthy sleep range for most seniors is between 7 and 9 hours per night, with consistent routines and restful, uninterrupted sleep. If sleep begins to stretch beyond that regularly, it may be time to take a closer look at what the body is really trying to say. Number 6. Ignoring sleep apnea symptoms. Ignoring sleep apnea symptoms can quietly lead to serious health complications, especially for older adults. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep, often without the person even realizing it. Common signs include loud snoring, gasping, choking sounds during the night, and feeling extremely tired during the day, despite getting enough hours of sleep. While these symptoms may seem harmless or simply annoying to those nearby, they often point to a far more dangerous issue beneath the surface. When breathing is interrupted during sleep, the body is repeatedly jolted out of deep rest. This fragmentation keeps the brain and heart from entering the restorative stages of sleep needed for repair and recovery. As a result, oxygen levels in the blood drop suddenly, putting strain on the cardiovascular system. According to sleep experts and cardiologists, untreated sleep apnea significantly increases the risk of high blood pressure, irregular heart rhythms, heart attacks, and strokes. For seniors, many of whom already manage heart-related conditions, this added strain can push an already vulnerable system into dangerous territory. Studies have shown that people with moderate to severe untreated sleep apnea are more likely to experience sudden cardiac events, especially during the early morning hours when REM sleep is most active. During these periods, the body should be at its most restful, but with apnea, it's in a constant state of alert due to oxygen deprivation. This stress response forces the heart to work harder, raises blood pressure throughout the night, and contributes to long-term damage to blood vessels and heart muscle. Doctors have warned that for older adults, especially men over 60, these risks should never be overlooked. Another serious concern with untreated sleep apnea is its impact on the brain. Oxygen deprivation affects memory, attention span, and decision-making. Many older adults report feeling foggy or forgetful during the day, unaware that their brain is suffering from the repeated oxygen drops occurring each night. Over time, this cognitive decline can mimic early signs of dementia. In fact, some neurologists believe untreated sleep apnea may accelerate the onset of neurodegenerative diseases, particularly in those already at risk. The connection between poor sleep and brain health is strong, and ignoring the signs can lead to outcomes that are difficult to reverse. Daytime fatigue caused by sleep apnea also increases the risk of falls, car accidents, and reduced quality of life. Seniors may feel unsteady, drowsy, or less mentally sharp, which can lead to dangerous situations in everyday life. Some people with sleep apnea also develop depression or anxiety as their energy levels and emotional balance decline. Many don't. Connect these symptoms to their sleep, which delays diagnosis and treatment even further. Diagnosis is typically confirmed through a sleep study, which monitors breathing patterns, oxygen levels, and sleep stages. Treatments vary depending on the severity, but the most common is the use of a CPAP machine, which gently keeps the airway open during sleep. While some may find the device uncomfortable at first, many patients report significant improvement in energy, mood, and mental clarity once they begin treatment. Other approaches include oral appliances, weight management, or surgical procedures when appropriate. Ignoring sleep apnea doesn't make it go away. It only allows it to do more damage over time. For seniors especially, recognizing the signs early and getting proper treatment can protect the heart, preserve brain function, and improve daily life. Anyone who snores heavily, wakes up gasping, or feels exhausted despite a full night in bed should speak to a healthcare provider. Treating sleep apnea is not just about better sleep, it's about protecting life itself. Number 7. Using the bed for everything. Using the bed for everything. Watching TV, scrolling on the phone, eating meals, or even working can slowly break down the brain's natural connection between the bed and sleep. Over time, this habit confuses the body's internal signals, making it harder to fall asleep, stay asleep, or feel fully rested upon waking. For older adults who already experience changes in sleep cycles due to age, this kind of disruption can have a deeper and more lasting effect on sleep quality and overall health. Sleep specialists explain that the brain relies on consistent cues to know when it's time to sleep. When the bed is used strictly for sleep and rest, the brain learns to associate getting under the covers with winding down. But when the bed becomes a place for stimulation, like watching TV shows, reading news on a phone, or having snacks, those signals become mixed. The brain no longer sees the bed as a place for rest, but as a place for alertness, activity, and engagement. This leads to what experts call conditioned arousal, where the body feels mentally active or restless instead of relaxed at bedtime. Older adults are more vulnerable to this pattern because age naturally brings lighter, more fragmented sleep. Any behavior that adds more wakefulness or stimulation around bedtime can make falling asleep even more difficult. It can also lead to a cycle of tossing and turning in bed, which only strengthens the association between the bed and wakefulness. The more time someone spends awake in bed, the more their sleep system gets rewired in the wrong direction. Over time, this can result in chronic insomnia, daytime fatigue, and increased irritability. There's also an emotional cost. For many seniors, the bedroom is one of the few personal spaces that feels private and peaceful. When that space becomes cluttered with screens, food, or tasks, it can lose its sense of calm. This clutter, both physical and mental, can create a low-level stress that builds up over time. The body may be tired, but the mind stays busy, distracted by the many activities it now connects to the bedroom. Experts in behavioral sleep medicine often recommend retraining the brain by using the bed only for sleep and, if applicable, intimacy. If sleep doesn't come within 15 to 20 minutes, it's better to leave the bed and do something quiet in another room until sleepiness returns. This simple shift can help restore the link between bed and rest. Keeping the bed sacred, as a place only for sleep, helps signal the brain that it's time to unwind. For seniors trying to protect their sleep and stay energized throughout the day, protecting that boundary can make a meaningful difference in how easily and deeply they rest each night. This helped you sleep better tonight. Don't stop here. Your mornings matter just as much. Watch our next video. Stop. 9 common breakfast foods that trigger strokes after 60 to protect your heart and brain. And don't forget to subscribe for daily health tips that truly support life after 50.